Huh? Okay. Oh.
Okay, good afternoon, everybody. Thank you so much for getting together with us. Today we have a very important event in cooperation with our wonderful public health department at Dover Air Force Base. And I want to start this meeting by thanking each one of you for being in this very important session, and also by thanking Captain Brown and his team at Public Health for facilitating this training. Captain Brown, the floor is yours.
All right. Thank you for participating, everyone. I had no idea there were going to be 72 people on this call. That is quite a few. I had no idea that you guys had that many staff members. It's pretty impressive. So in any case, my role here today is to do mostly reminder educational COVID mitigation measures. You know, the preventative measures haven't really changed all that much from the beginning of the pandemic. I think enforcement really is the biggest thing, and you know, policing one another and making sure that everybody is following, you know, the rules essentially, to minimize the impact that COVID has on your operations, and to, you know, protect you guys and the staff as well. Because, you know, if we can avoid getting it, then we should try to. As you are all very well aware, I'm sure there's been quite a few positive cases from the beginning of the pandemic over at both the CDC and the U Center, both for children and caregivers as well. And so we, you know, we work closely with you guys, with your leadership team, to make sure that we provide all the tools that we can to minimize the risk of transmission over there. So I do have a slide deck, Dr. Brizuela. I don't know if it's possible to share that.
Sure.
Oh, wow. Okay, cool. So the first slide is just the welcome. Okay, perfect. Yeah, if you could just scroll down. So these are recommendations for the staff. And again, this is going to be very brief. You know, I basically have 2 slides here. So, and it's nothing new. None of this should be new. I want to leave much more time for questions and answers, because I'm sure there will be some, given the number of participants we have here today. You know, the adherence to social distancing, that really hasn't changed. For close contact purposes, how we determine that is within 6 feet for greater than 15 minutes over a 24-hour cumulative period of time. So like if you were around someone who was positive for 5 minutes in the morning and then 10 minutes in the afternoon, we would consider you to be a close contact. One of the issues that we have over there is the number of children and caregivers who, I know you segregate out the age groups, but there's still mixing of classrooms, and so when we do that, we get a lot of people who are exposed and who become close contacts. So you know, we really encourage you guys to come up with a cohort type of arrangement where the same students are with the same caregivers throughout the entire day for the entire week. That would really help to minimize the transmission and the exposures when they do happen. Mask wear while indoors. So we recommend wearing grade 2 or grade 3 surgical masks not just cloth face coverings. These masks provide a higher level of protection. So definitely recommend surgical masks, specifically grade 2 and grade 3. Frequent hand washing, of course, which I know you guys are very diligent about as part of your standard infection prevention protocols. Morning temperature checks. So that should be done for both staff and for children as well. Probably the most important thing, and something that we see over and over and over and over again, is folks that are sick and they're coming into work. You know, I think there's a tendency for people to say, it's just a head cold. I just have a stuffy nose. It's no big deal. I'm going to come into work anyways. Please do not do that. You know, if you think it's allergies, you think it's a cold, you think it's something other than COVID, it certainly can be, but it's probably COVID. Because right now in the community, there's a 60% positivity rate for people who get tested. That means more than half of the people that go to these lines to get tested at these testing clinics are testing positive for COVID. So it's out there right now. So if you are at all feeling ill, don't come to work. Do not come to work, because you're going to expose your colleagues, you're going to expose kids, and you probably have COVID, and you should probably get tested. So that's the biggest foot stomp, really. If you take nothing else from this presentation, take home, staying home when you feel at all ill and get tested. It just makes things much more complicated, and many more people are exposed when y'all are at work for 3 days sick. And another thing we can do is limit the capacity in rooms. So like the break room, for example, like I recommend putting like a limit on the number of folks that can be in that room at any one time, so that people can adequately socially distance, especially when masks are off and people are eating food. They really need to be socially distancing. Getting a booster vaccine is going to be super important, because it will reduce the need to quarantine. So like, as it is now, if you're considered exposed, you're going to be quarantined for 5 days, and then you got to wear a mask for 5 days. If you get the booster vaccine, you will not have to quarantine. So that's awesome. It's an incentive. It protects people. I know there's like a lot of misconceptions and fears about the vaccine. But the reality is that, you know, the folks who are getting severely ill and who are hospitalized and dying, those individuals are much, much more often than not unvaccinated. So the risk is 15 times higher for severe illness and death for those who are unvaccinated compared to those who are fully vaccinated. So I'll foot stomp that, and then we can go on to more of the general recommendations, more for management of the CDC. If you want to go to the next slide, Dr. B.
Sure.
All right. If you could scroll down still to the general recommendations. Okay. So excluding children from the CDC who are sick. So that's why the temperature checks in the morning are going to be super important. If it's greater than 100.4, they need to go home and they need to see the provider. I know that's like a challenging thing to do sometimes, because parents really don't want to, you know, change their plans during the day. But the second and third order effects, you know, of someone testing positive, we have, you know, 15 kids in some cases that are put on quarantine for 10 days. So like that takes out a lot of people, and then you have even more angry parents because their kid has to stay home for 10 days and they have to take leave or whatever. the case may be. We recommend administering a screening questionnaire to everybody who comes into the facility on a daily basis. Major Jello sent you guys a CDC mitigation plan that has the specific questions on there. I recommend that you guys take ownership of that plan and adjust it to make it fit, and then distribute that plan, Dr. B, to all your providers, so that everybody knows the policies, and that people can be held accountable. Again, as I mentioned earlier, the cohorting of the rooms, that's super important. I know you cohort based off of age, but even better yet would be to cohort based off a classroom, to have the same students with the same providers for the entire week. And then, I don't know about certain activities that require, close, like physical contact of toys and whatnot that are shared. As much as you can, try to avoid those, like Play-Doh and other types of toys where like one kid plays with it and then another kid can play with it without it being disinfected between. And then of course, the standard disinfection protocol that you guys do, doorknobs, commonly touched items, that kind of stuff should be disinfected on a regular basis. That's about it. I mean, it's, like I said, it's a very brief presentation, more of a reminder of the things that are important when it comes to this virus. But I do want to open up the floor to questions, and we can take as much time as we need to thoroughly explore those.
Captain Brown, thank you so much for the presentation. I think the first question that I wanted to ask on behalf of our squadron as well. And by the way, we have members from other flights present. We have members from our HRO, CPO areas. They are very interested to listen to your presentation. One of the things that I think our concern is, because we've been working together for the last almost year and a half on COVID-19. And as you know, it has gotten to the point that this new variant of the virus is so contagious. However, it's not as fatal as the other ones. What are we going to be doing about teaching, educating our community of the facilities? Because we noticed that some of these cases, not all, are coming from the outside. Is kids coming from schools, not being vaccinated, or parents who go out in the community, out and about. And is there a plan for us to continue educating the military community that are out of our facilities?
So yeah, I mean, it sounds like so it is definitely true that what we see on our base is most often a reflection of what is happening in the local community. Over the holidays, especially, a lot of people traveled and they were exposed through family gatherings during Christmas and the New Year's. A lot of people traveling to New York City, Baltimore, DC, and getting exposed in that way. So yeah, unfortunately, we'll never really know unless we can directly link someone who has been exposed and then they test positive a few days later, which happens quite frequently. But more often than not, it's very difficult to know definitively how someone was exposed. And when cases in the community rise, generally speaking, we see cases within our staff and active duty population rise as well. So yeah, the best we can do is try to implement these measures to protect everybody in the workplace. Obviously, on your own time outside of the facility, we don't have jurisdiction over what what people do on their free time. It's the reality of it. We can't enforce that kind of stuff. And very likely, a lot of the cases that have happened over at the CDC have occurred from off-base exposures. But again, impossible to know for sure.
Thank you. There's a question on the chat that says, please let me know if the Base Theater still doing testing between 6 o'clock and 9 o'clock in the morning, Monday through Friday.
Yeah, so that is just to clarify that question, give some background. That's for individuals who have not been vaccinated, staff who have not been vaccinated and who are opting either for a religious exemption or a medical exemption. And so while that exemption is pending, they are required to get tested on a weekly basis. Unfortunately, that testing isn't open for everybody and anybody who just wants to get tested. For folks who just want a test because they're curious and they want to, rule out the possibility of COVID or bringing it back to their family or whatever, there are many, many options in Dover to get free tests. Dover has the Division of Public Health has a website that has all the testing locations and times and phone numbers and all that. So it's very easy to look up. And then in terms of if it's Sergeant Boynton, do you know if they've suspended or if they're still ongoing with the weekly testing for unvaccinated? They're doing it. Okay. Yeah. So it is still happening for those folks who require it.
Hi, Captain Brown. Oh,
go ahead.
sorry.
Go ahead.
So my name is Alice. I'm the assistant director. I just have a question about you encouraged our staff members, if they have runny noses or they think they have a cold or allergies or anything like that, to not come into the facility. So what can be done to educate the community at large to prevent parents who have children with runny noses or any of those more subtle signs of infection? What's being done with that throughout the community to encourage those parents to not bring their children into school? And what communication is going through to the squadrons to make the public health issue a priority, so that their people aren't getting blowback from their squadron commanders for keeping children home with runny noses?
Yeah, no, I hear that. That's a good question. Honestly, that's probably a better topic of discussion for an offline conversation. Maybe we can come up with some messaging together with you guys for and maybe in coordination with PA or something like that to provide some of that education to the parents of the children.
Hey, thank you.
Mr. Wilkerson has his hand raised. I'm going to give the mic to Mr. Wilkerson. Let me see. Mr. Wilkerson, you can unmute yourself.
Yes, thank you, Dr. B. Captain Brown, thank you for giving us the presentation and educating us on how to be safe. My question goes out to you, Captain Brown. Can you explain on how are you doing your timeline with quarantine? I've noticed some have coming back with 5 days and then some are coming back with a few more days. If you can give us more clarity on that.
Yeah, of course. So for children, okay, it's a little complicated and the CDC guidance changes fairly regularly. So it's always an iterative process where, when those guidelines come down, we try to implement them in ways that make most sense for our base population. In terms of the current guidelines for children, kids can't, the ones that are, less than 2 years of age, they can't wear a mask. It's not recommended that they wear a mask. And so the guidelines for the CDC say, okay, when you isolate, you isolate for 5 days, and then you wear a mask for an additional 5 days. Because infants aren't able to do that, we've made a blanket policy for the Child Development Center that for children who test positive, it's 10 days of isolation. So there's that. For the quarantine, which is the people who are exposed, right? Isolation is for folks who either test positive or are sick, symptomatic. And then for the quarantine, for the staff, we're following the CDC guidelines, which is 5 days of quarantine and then 5 days of strict mask wear. For the children who are exposed, we are doing 10 days of quarantine. Does that help to answer your question? I know it's a little confusing, but yeah.
Thank you. Okay, we also have a question from Ms. Cherise Bogle, who is one of our family childcare providers. Ms. Bogle, you can unmute your mic and go ahead and ask a question.
Hi, Captain Brown. So in my household, of course, it's a chain reaction. So I know like the quarantine and everything. So we've been basically quarantined since Friday, since my son tested positive. And then today we just got news that me and my daughter tested positive. So with the household, like my husband's been calling to, go back to work because, his work's been asking, hey, when can you come back to work?
Yeah.
So he has to retest today, I guess, because, the positive cases or whatever is in the household, because he did test negative, but since, we tested positive. So anytime someone tests new positive, does it reset everybody else's quarantine?
Yeah.
Okay.
Yeah, so that's a really good question. And this is another bit of a complicated question to answer. So it all depends on when that person finds out about their positive test, if they can actually isolate themselves in the household, away from their kids, in a separate bedroom, basically locked away. If that is possible, then the quarantine day starts on the day where that person goes into their bedroom. If let's say it's a kid who tests positive, a 2-year-old, there's not going to be any way to isolate that child, right? So that kid is very likely going to be around the parents, and very likely the parents are going to get COVID. And so we, in the event that the parent doesn't get COVID, even though there's a continuous exposure, we do 5 days from when that kid is recovered. So let's say the kid tests positive on the 1st of this month. He or she will be considered recovered on the 6th of the month. That will be the last day of isolation. And then 5 days from the 6th would be the quarantine period for the adults in the home. Does that make sense? So it would be then the 11th for the parents when they would get off of quarantine, essentially. But of course, if they start showing symptoms, then they go into isolation.
Yes.
And then isolation for 5 days. And then if the other parent still is not symptomatic, hasn't had it, but the 2 spouses are still in contact during that time, then we're going to have to wait till one of those spouses recovers. And that's 5 days. And then the quarantine will be starting from the end of that person's recovery.
Gotcha.
So it often happens that when one member of the household gets it, the whole family's kind of on lockdown for an extended period of time.
Gotcha. Okay. Awesome.
Yeah.
Okay, so we have another raised hand, but before then, I'm gonna read one of the questions from one of our staff members. It says, if we have the maximum capacity of 15 children per room, what are the rooms? I'm sorry, it's moving down. What are the rooms going to do who have above that? Because in my classroom, we have 18 kids. Okay, I'm gonna respond to that question. And the new directive as per last week is that we are no longer combining classrooms, number one. The maximum capacity per age group is 15 kids. However, we're following our own ratios, which means 4 for infants, 5 for pre-toddler, 7 for toddler, 12 for preschoolers, okay? And as much as we can, we're gonna try not to do double age groups, because we have some classrooms that are bigger than others. Some only allow us to do one age group, which means we're not going over 12 kids anyway, okay? So right now, our current attendance is very low, which allows us to keep that rule under control. And we hope not to go into the situation where we might have to add more than what we need to each classroom, okay? So we're working on that. There's another question, sir. It says, if we tested negative after exposure while having mild symptoms, but then soon after we get worse symptoms, do we actually need to get tested again if we were able to isolate?
So, yeah, that's a really good question. That's a really good question. First of all, there's different types of tests, and some are better than others. If you get an antigen test, usually those are rapid tests. I mean, you'll find out within 15 minutes. Those are not as good of tests as a PCR test. Generally, the PCR tests are send-out tests, though, and those take a couple of days to get the results back, at least 2 days, sometimes more than that. Those ones are more reliable and they're more accurate. So there's that. And so if your symptoms get worse, it probably would be worthwhile to retest. Granted, there's other diseases out there, right? Not everything is COVID. But given the surge right now, it's most likely COVID. If you do isolate yourself for 5 days from when the symptoms start and then continue to wear a mask for 10 days, you're doing the right thing for sure. You're doing the right thing. But the benefit of knowing whether or not you were positive it's important for a lot of reasons. A, it allows us to do contact tracing, because otherwise maybe you had COVID and you probably did, and you isolated, but you may have exposed someone and that person will never know. So there's that risk, I guess, there. The other risk is for people who have tested positive and then they get re-exposed within 90 days, they don't have to quarantine. So it's helpful to know that as well, because if you get exposed and you thought you had COVID, but you didn't know for sure, you'd still have to quarantine. Hopefully that makes sense. I know it's maybe a little confusing, but I'm trying my best to explain this stuff here. It's a little complicated for if you're learning it for the first time. I understand.
Okay, so the next question says, when a child is tested positive, why can't siblings still go to school? Isn't that causing more possible exposure?
Why can't, here, let me see if I can.
Why can't children? Yeah, actually, I can respond to that. I mean, we have control of the children who come to our programs. If they have older siblings to go to the public school system, we have no control of whether or not they go to school or not. That is a call that has to be done by the family.
Okay, I see.
Yeah.
When a child tests positive, why can siblings still go to the school? Is that causing more possible exposure? Well, the siblings really should, okay, so this is another little complicated one, because we don't manage, the Dover Air Force Public Health doesn't manage what the schools do in Dover. Even the school on base, we don't have jurisdiction over them. They fall under the school district, the Dover School District, and the school district has their own rules and regulations for when children are allowed to come back to school. It sounds like they're allowing siblings to come back to school. We are just not willing to accept that risk here at Dover Air Force Base, at the CDC specifically. So yeah, I apologize that sometimes the guidance that the state has conflicts a little bit with the guidance that we have on base. But it is what it is. It's something
Captain Brown, it's Alice again. So just to hone down that question a little bit. So I think that the concern that the staff are having is that there are 2 children enrolled in the CDC, siblings. One is 1, one is 3. The 1-year-old tests positive,
yeah.
and the 3-year-old is not quarantined. Or we have situations where the 1-year-old is exposed and we wind up quarantine, and the entire classroom winds up getting quarantined, but their older sibling, who is not directly exposed to someone, is still attending the center.
Okay. Hold on, let me close this. So certainly if
I understand that the older sibling who is not in direct contact with the person, you know, has less likelihood, but given how subtle the symptoms of the Omicron variant are, it's entirely possible that the child who has been quarantined is either asymptomatic or it's just a runny nose and the parent doesn't think anything of it. And so that child actually does have COVID, and they're continuing to bring their sibling to the school because there is no quarantine order for the sibling because they were not directly exposed to a positive person. Does any of that make sense?
yeah, I mean, so if someone if one of the kids in the household tests positive, certainly the child should be placed on quarantine. The sibling should be placed on quarantine. If we don't, you'd have to, like, again, that's another one we can talk offline more about. But the sibling should not be coming in to the CDC for at least, well, for the children, we're doing 10 days at the CDC, so they should be quarantined for 10 days.
When we have exposure lists, should we include the name of any siblings?
Oh, yes, certainly. Yes.
Okay, so include the siblings. Okay.
Yes. Yes, for sure. Yeah, that we can talk more about that offline. But we have been, you know, we used to do essentially phone calls for like everyone who's
Right.
exposed. And then we find out through those phone calls, you know, that there are other folks in the household that need to be quarantined as well.
Right.
We've switched over to sending essentially mass notifications.
Right.
And obviously that is a loophole that we need to address. So,
Okay.
yeah.
I think Ms. Alana wanted to say something. Ms. Alana, you still want to ask a question or statement?
No, Alice actually got it before
Okay.
I got it.
Got it. Good. Okay. Any other questions?
I actually, Dr.
Yes.
B.
Go ahead, Jennifer.
So I'm Jennifer. I'm one of the trainers at the CDC. Earlier, I heard it mention ages 2 years of older should be wearing a mask. The CDC only does 3, 4, and 5-year-olds.
No, that is correct. 3, 4, and 5.
3, 4, and 5.
Yeah.
So not your statement of 2 years and older.
Ms. Jennifer, we'll talk offline.
2 years and younger should not be wearing a mask.
2 years and younger. Cool. Thank you.
All right.
It looks like we have a question from one of the staff members. So they're saying that if they're fully vaccinated and they get tested, why are they allowed to come to work while they wait for the results? They can be asymptomatic and still spread the virus.
Okay, so folks who are fully vaccinated, the CDC changed their guidance essentially only folks who are boosted now don't need to quarantine essentially. It's the folks who are fully vaccinated either outside of 6 months or within 6 months. They need to quarantine. But yeah, it's certainly possible that someone can be asymptomatic and be spreading COVID. I mean, that has been the case from the beginning. It's not going to change. You know, the likelihood of that happening with the vaccine is lower, but it's still possible. So even folks who are fully vaccinated will require a 5-day quarantine.
Okay, anybody else?
Actually, can I ask more about that? So I think the question is mainly, some of our staff were with a person who tested positive, so they had to go get tested. And as soon as they got tested, they were told they could come right back to work without knowing their results. So the question is, I think, is why are they allowed to come right back without knowing the results? Shouldn't they wait until they know the results after they get tested?
Well, we're not even doing testing for close contacts anymore. So I don't know when that happened. We used to do a test on day 7, and then release on day 10 for quarantine. But if someone was exposed, if they want to get tested, they certainly can. But that doesn't allow them to come back to work until their quarantine time has ended. Does that make sense?
Yeah, I think that makes sense. Thank you.
Yeah, I mean, it sounds like that may have happened. That should not have happened. Yeah.
But you say that if that person is boosted, then they can come back to work if they're boosted.
Yeah, well, I'll have to double check with my major on that. To be honest with you, that's what we're doing with the med group folks. But I don't know if we've run into that situation yet with folks at the CDC. But at least for the med group personnel, if they're fully boosted, they don't need to quarantine, but we do test them. So that's something that I'll follow up and verify for you.
Okay, any other questions? All right, well, it has been a very good session, Captain Brown. Thank you so much for giving us we know you're very busy, so we'll continue working with you and the PH group to coordinate efforts. And of course, I think that, like you said before, we have some room for improvement always. You know, I think communication is key. So I really appreciate your time, sir, and putting all this together for all of us. And with no further ado, I mean, I'll go ahead and finish recording this video and finish the meeting.
Yeah, thank you so much for having me. Thank you, everybody, for giving me your time and attention. I think as questions come up, because I'm sure that they will, please direct those questions to Dr. B or one of the other leaders at your team, and then he can communicate those questions to me, and then I can provide an answer back to you, because I have no doubt that that those kinds of questions, and they were all great today, come up on a regular basis. And so we want to make sure that you guys are educated and have all those accurate answers.
Thank you, sir. Thank you, everybody. Have a wonderful afternoon.